Hello, everyone. This is Rick again. In this short video lecture, I'm going to show you how to go through patient Moro and find the diagnoses to code. We'll touch on some guidelines. We'll touch on how to find the codes in both 3M and the code books. But the first step is to find out the diagnoses. So let's have a look at our patient. And again, we're going to log in to Ehrgo and take a look at the encounter on Jason Moro. Okay, so with Jason Moro, he's coming here for his new primary care visit. He has past medical history, chronic sinus drainage, hypertension for approximately 8 years, and a malignant mole removed 3 years ago. Right? So the question remains, what are his diagnoses? Let's move on. We have his history. After the history, we should read the family history and social history. Will give us some clues. Mother died of an acute MI, mother deceased due to lung cancer, had hypertension, diabetes, brother 68 has hypertension, hyperlipidemia, sister has known medical problems, social history, patient's been married for 39 years, has one son who's healthy, quit smoking 6 years ago, states his alcohol intake is too much, doesn't pay attention to his diet, eats what he wants, never been on special diets. Now we get into some interesting things that give us some clues as to what's going on. The meds, he's taking a slide, 2 sprays each nostril a day. Thiazide, med used for hypertension for 8 years. Sudafed, and Aleve for his elbow pain. The coding guidelines say to code things that are assessed and managed. Let's see what we have that's assessed here and managed. General, patient is a well-developed, well-nourished, moderately obese Caucasian man in no acute distress. His blood pressure is 150/98. That would meet the criteria for hypertension. His BMI is given, so we're going to code that per the tabular and the coding guidelines. It's given here at 27.1. So then we go on. Going on in the exam, we see here rectal GU, prostate 2 plus, meaning he has an enlarged prostate, benign without nodules. So they did a digital rectal exam and they found an enlarged prostate, right? Labs, what do we have here? FBG of 172, meaning he's got elevated blood sugar or abnormal glucose. Now we get to the assessment. Hypertension, lipidemia, increased blood sugar, which is the BS, and the BPH for the enlarged prostate. The plan, refer to dietitian for diet recommendations for prediabetes, hyperlipidemia, and HTN. So when we look at this, again, we don't code off the labs per se or the imaging. We code off what the physician documents. But in this case, we have a very strong case for abnormal blood sugar or elevated blood sugar based on this. Not only does he come out and say it, they also uses the term prediabetes. In addition to the labs that show the elevated cholesterol at 290, they come out and say hyperlipidemia. So all in all, the problems that we should be capturing, I would code the hypertension first, since it's the most chronic problem, seems to be the one that they're very concerned about. You can find that in the assessment or diagnosis. It's always worth looking at the vital signs. The hyperlipidemia should also be captured. They come out and say that. It's also reflected in the labs with a total cholesterol of 290, right? The blood sugar is mentioned, right? Now, this is where it can get a little confusing. It does say that his blood sugar is elevated. If you've ever been to primary care recently, many times they will ask people to come back for another assessment of their blood sugar, right? So until they give a diagnosis of diabetes or what have you, it's going to go as a sign and symptom code, right? Because we don't code probable or what have you in the outpatient setting per the guidelines. So we'll be coding that. The BPH is also coded. And then the obesity. You might ask, where did we get the obesity? Moderately obese Caucasian male. So that should meet the criteria. Also with the BMI of 27.1, right? We also have the past history of smoking and the body mass. All in all, you should be, there you have it. We should be getting the hypertension, hyperlipidemia, the elevated blood sugars, the BPH, the obesity, and then also the history of smoking and the BMI. In the next video lecture, we'll show you how to find those codes. Thanks for watching. Please reach out with any questions.